For this bioethical dilemma case study, our group was assigned the topic of respect for autonomy. But before getting into the details of this principle, I want to give a quick overview of the four main principles of biomedical ethics. Uh, these four principles were first published in 1979 by philosophers Tom Beecham and James Childress. And Beecham also co-wrote the Belmont Report, which you guys might be familiar with. It was also published in 1979, and basically this report summarizes ethical principles and guidelines for research involving human subjects. And back then, this was a big issue because there were lots of unethical research involving human subjects. So you can see on the slide here, the four major principles of biomedical ethics is respect for autonomy, non-maleficence, beneficence, and justice. Respect for autonomy states that healthcare workers or the research experiment or the patient care in general should respect the patient's independence, and that the healthcare workers have a duty to respect patient preferences. And it's important to note that we're talking about respect for autonomy and not just autonomy. I know a lot of us are familiar with the Guide to Code of Ethics for Nurses. It's that small book with our code of ethics, basically. And Marcia Fowler in that book says that it's important to note that the principle is not a principle of autonomy. It's the principle of respect for autonomy. Usually there is that word respect for somewhere around the word autonomy. So I'm quoting this from the Code of Ethics book. This is on page 16 of Fowler, published in 2015. She says, there is no principle of autonomy. Autonomy by itself is not a principle. If autonomy itself were a principle, it would mean that each of us has a duty to act autonomously. We are not, however, obligated to act autonomously. Many of life's choices are made non-autonomously, whether by habit, compulsion, coercion, or simply without rational consideration. End quote. So in later slides, we'll see some examples of when our life choices are made non-autonomously, like we're not consciously making a lot of our decisions in life. And then really quickly, the other three principles are non-maleficence, beneficence, and justice. We'll just go over it briefly because our main topic is respect for autonomy, and I'm excited to see how the other groups are going to teach us about the rest of these ethical principles. So non-maleficence states that we shouldn't inflict harm purposely to the patient. So an experiment would be like the Tuskegee syphilis study, where men were purposely not given, they were purposely given syphilis, and then once they found the cure for it, they're like, actually, we're not going to give these men penicillin. We're just going to see how this disease progresses. And so that's a type of maleficence. So basically, the principle is saying that we shouldn't do things like that. And then beneficence states that we should do good for others. We should prevent harm, remove harmful conditions, and or also take affirmative action to benefit others. And then justice is justice. Fairness, it's basically fairness in the distribution of social burdens and benefits.